Thank you for having me and inviting us along. And Clive and I run two quite similar, but in many ways quite different projects trying to address digital exclusion. So mine covers geographically Hertfordshire. Clive will tell you all about his. It's bits of Essex. So together we cover the whole ICS area. And our project came out of some conversations we had during COVID, which were at that point driven by the impact of digital exclusion on isolation, particularly, but also on health. And so we tried to create a program that would start to address that. So in that, it's one of the first things, is we know the ICS is very clear that it needs a cohesive digital strategy. And I think that's essential to the way healthcare will go in the future. And for all of the reasons on the slide, which I've just lifted from our own data, that should start to improve population health, and it should start to allow people better access to healthcare. However, I would contest that alongside this, we need to find ways to address digital inclusions and digital inequality that we face. And trying to put that in context, that one of the figures I heard from Jim McManus was that digital exclusion in Hertfordshire could be as high as 10% of people. So I think it's no surprise that we've got some groups that we know are more likely to be digitally excluded than others. I think we're aware of this. This is data taken from NHS England, so we know these bits. I think I would add carers as a group, which has not been included in this. And it was interesting that Tim just raised the same point about carers often being missed off from these sort of things. And I think they probably are as excluded, if not more so, than the disabled people that have been identified. But there you go. So what we'll try to do is Clive and I'll try and explain what we're doing with examples as we go of how we address some of those groups. So our project in Hertfordshire is called Staying Connected. It's got 4 steps to it. So we repurpose redundant IT equipment. We add connectivity to that where appropriate. We then get people started face to face on a one-to-one basis. And then finally, we support their ongoing skills. And I'll take you through those 4 steps and kind of how they fit together as we go. So repurposing equipment, so that you can take any one or more of these steps depending on what the individual needs. What we're doing is we go out reaching out to businesses in Hertfordshire, and particularly around the end of COVID, what was happening was that a lot of businesses were sending their employees home. And what that meant was that there was a lot of IT equipment that was getting scrapped. And so we asked them to donate that equipment to us so that we could use that to spread out amongst people who needed it. We then commercially wiped that. And we do that in a way that gives a certificate for GDPR basis. So actually, it's the same level of wiping as if you send your devices to any of the places you might want to send to wipe them up. The only thing better if you don't want your information to get out is to smash the hard drive up with a hammer. So that sort of level. We then re-imaged that equipment with software. And we gift that to people who are digitally excluded and who are referred to us. And our referral process is initially was through social prescribers, and we worked with the link workers particularly to identify people who had needs. And we found that actually we were able to deal with more people who could benefit from our services than were coming through. So we've opened that referral up. to all charities in Hertfordshire, and now we'll take referrals and self-referrals from anyone. So if you're Hertfordshire based, for me particularly, and Essex for Clive, I guess, and you're interested and you think we could help somebody you're working with, at the end of this, I will leave you some details of how you can refer in. But sometimes equipment is what's needed. So here, the story of Graham and Shirley, they came to us because they were both in their early 60s. They had many health issues, and both of them had cancer at one point, and that had meant that they were no longer in employment. So they were both claiming benefits. So universal credit changing caused great problems, and without digital equipment and ability to use it, they were really stuck. So they came to us, and we were able to gift them a computer, and we were able to give them the ability to use that and work with them to do that. And that meant that they could start to access their benefits online. And they could start to understand what was going on online, and they could access healthcare online. So they came to trust what we were doing for them, and became much more included digitally. And therefore, with the laptop and the training, they were able to access not only that benefit but healthcare support. So Graham's health sadly became worse, which meant that he had to apply for his work capability forms and his PIP, and that was all had to be done online. So without the project, Graham would have been left in a position where he was struggling to get hold of all of his benefits, and that would start to impact on his health and his mental health particularly. And he credits the simple intervention of just giving him a machine and showing him how to use it with resolving that point. Adding connectivity. So one of the things we do is we add connectivity. Again, we've gone out to Tesco Mobile and to Vodafone, who are our partners in this, and they've given us effectively an unlimited number of SIM cards that we can just gift to people. So it's free of charge. It's 5G. The Tesco provide with some dongles, so some of the machines we have to retrofit that into. But it does allow us to make sure that people can access pretty much all of Hertfordshire is covered with 4 or 5G connectivity. But it doesn't work in all the rural areas, which is worth just a point of note. So to do that, that's great. We've now given you a bit of equipment that has the ability to connect to the internet. The problem with that is what we've really given you at this point is a doorstop. Because unless you know how to switch that on, unless you know how to use it, that is all it is. There's a lovely video online that you can look up somewhere that has a young woman and her apparently father cooking, and she said, "Oh, did you enjoy the iPad I sent you for Christmas?" He said, "Yeah, it's lovely." And he turns around, picking up his iPad that he's been using as a chopping board, scrapes it off and puts it in the dishwasher. And that's what we then try to address with our next step. So we take volunteers, and we've recruited volunteers who are digital champions. And they do training. They work through Digital Unite, which is a national accredited training scheme for digital champions. And they go out and they work face to face with people on 1 to however many sessions they need. On average, it's 1 to 2 sessions that people need in order to get moving. And they'll sit there and they'll answer the silly questions. They will spend time dealing with the things that when I'm working with my mother and her digital needs, are the most frustrating things in the world. And they do it with patience, and they do it with dignity, and they offer some respect, and that is fantastic. And sometimes that's all that's needed. So Mrs. M was somebody who was referred to us because she had a computer, and it was running on Windows 7, and because that was no longer supported by Microsoft, and I think the paperclip used to really annoy her when it popped up. So she knew she needed to replace that, but she just didn't know how to, or what to buy, or what any of it meant. So Digital Champion worked with her, was able to find her a laptop that she was able to purchase, so it wasn't drawing on our free ones, and she was able to get back online, and they were able to work with them. Now, beforehand, Mrs. M was housebound. She didn't like having visitors. She was still trying to shield, and everything that she had to do was over the phone. She hadn't seen her family for a couple of years in any meaningful way, and just really relies on that computer to access the outside world. And particularly, what this allows her to do was start to access her shopping online. She was able to see her family through Zoom, and that allowed her to feel safer. And as she felt safer, she was more and more willing to start to step outside, and allowed her to understand and access that world. In fact, in the end, she most recently, I heard she was buying some curtains from John Lewis, which was a wonderful step forward. So for her, that started to show how things could be in a new world, and she's really happy now. She has a new laptop. She does her online shopping. She knows about antivirus stuff, which therefore she's not worried about that sort of activity. She understands about cookies. She knows how to manage that, and her mental health is in a better position, so she's able to carry on. Finally, what we then had identified is that people who are digitally excluded are often also physically excluded. So we've run a series of training courses. These are digital classes. The one I think in the screen is how to use a mobile phone, which is I'd actually sat in on that one, which was interesting. I learned something myself. So we have training opportunities through those. It allows people to be more familiar with a group. It allows people to learn things about day-to-day usage. We do some of the courses that are around training for work, and people can access those. But what they all do is they address that social isolation. And it allows people to be part of a bigger group and start to build friends. So we had a young lady's name I'm going to have to look up, and Pashna was referred to the Job Smart Centre because she was suffering with anxiety, depression, and severe isolation. So she was able to come along to one of our projects. That was something that allowed her to grow with other people, and we saw her growing confidence, and her social skills came to grow as she came along. And that's meant that by last February, she started to come along and start to make friends, and her confidence has grown. She still suffers from anxiety, but she's managing that. And all of that comes along. So she said, although getting myself into the world, so to speak, helped with mental health, I enjoy doing things which isolate me. So, but this was a good way to interact, and often was an opportunity to meet people who had the same issues and could talk about the same stuff that we had in common. I'm so pleased I pushed myself to go. So that's it's a 4-step process. Those are the 4 steps. In terms of impact, so far we've given away around 386 items. This was actually September's figures. 144 people have got other equipment, 133 connected, about 1,000 people supported by digital champions. and 800 sessions to people have been delivered. And interestingly, because what we're doing moves equipment that was otherwise bound for landfill and reuses that, we've saved around 94 tons of carbon through this program at the same time. So I'm going to hand over to Clive when I can work out how to stop sharing. And then if you've got questions for me at the end, feel free to ask.